Now we look at the eGFR. So we've spoken about the GFR, where I told you guys that GFR is basically what? Glomerular filtration rate. You understand? So all of these parameters, eGFR, that's the estimated glomerular filtration rate. I think there's fractionate sodium output and all those stuff, you know, potassium output, how the kidneys is, handling phosphate. All of those parameters are just trying to look at your kidney health. Okay, how well is your kidneys functioning to actually make urine, take out waste product from your body and the rest of it. Okay, so for EGFR, let's focus on it. You should know that it's actually a test. So I'm doing this test and I'm trying to know, I'm trying to expect the results to show me how your kidneys are actually functioning and filtering out waste, because that's the primary function of your kidneys. So a normal eGFR is usually above 90. I think they measure it as what? Mils per kg per 1.73 meter square. I think that's the unit there. Okay. I think that's a unit. They wrote all of this without units, but I think that's a unit there. Okay, so basically, let's look at it. So kidney function, to estimate how your kidneys are functioning, cleaning up your blood, taking out waste, and also it's a basis of calculation. So it uses blood creatinine. It's a waste product from muscle activity. So there's some levels at which creatinine should be in your body. Do you understand? So if your kidneys are functioning well, your creatinine won't hit so high. But if you do a creatinine level and it's so high, that's to tell you that there's a problem, right? So it matters because sometimes kidney disease is just going on very quietly, no symptoms. So you now use this at the early stage to now know that, okay, somebody doesn't have symptoms, but yes, the person still has a kidney disease. So this is how the test could look like, and it's basically blood based. I take your blood and I try to measure, the creatinine in it. Or sometimes I can like check out how much urine you are passing for like a day, or let me say in some hours. Then I'll see how much urine you are making. Do you understand? So normal ranges for adults, it should be about 99 to about 116. Okay, age related decline. As you are getting old, it's going down. So but normal function in general should be above 90. So if you are having some mild issues, you see that the levels are going down about 60 to 89. Okay, then severe conditions is dropping as low as 15 to 59. So this is a proper staging. Stage one shows you that it's more than 90, no issues, but probably you can see proteins in urine. So they do what? Proteinuria too. This test is not a standalone test. I also do this test alongside other tests in the lab. Okay, then stage two is about 80 to 89. Stage 3A trade B is about 30 to 59. Stage 4 is about 15 to 29. Then stage 5, anybody that is having the kidney function is dropping as low as what? 15 mils per kg per 1.73 meter square. I know that this person is either I do a kidney transplant or I keep this person on dialysis for life. Okay. So factors that can affect eGFR is it could be different from different person to another person by age, muscle mass, the kind of food you eat. If you are pregnant women, they ease themselves more, liver disease. If you are dehydrated, of course, you don't have much, so you can't give what you don't have. So if you are dehydrated, you also make little urine, you know. If you have all those, polydipsia, you are taking so much water, of course, you now have polyuria, you'll be putting out so much urine. So basically, this is what EGFR is. And these are some of the reasons why we might actually order for an EGFR in the lab.